In this video, I'll discuss the trouble of rushing to use medications in dermatology, and we'll talk about the technological advancements, the miraculous technological advancements that have been happening in dermatology continuously over the past few decades, as well as a more cautionary approach to using new medications as opposed to using the tried and true technologies and just basic great skincare to address the fundamental issues that patients face on their way to treating their condition successfully. Before we get started, don't forget to smash that subscribe button. Also, don't forget to share and like this video. Now let's get going. So guys, I'm a big fan of technological advancements, specifically biotechnological advancements, especially new applications in medical technologies, specifically drug development. And over the past few decades, we've had a hair-raising rate of developing new medications, new technologies, new drug classes for treating old-school dermatological conditions that up until a minute ago were very difficult and challenging to treat, with a lot of pitfalls in the treatment seemingly. And people have been struggling with those conditions for a very long time and continue to struggle with them. Specifically, conditions like atopic dermatitis, which is a common childhood condition which is on the rise in America, as well as other conditions such as psoriasis, which is an older population demographic condition. Those conditions have seen great advancements in developing new pharmaceutical options to treat those conditions effectively, and I'd say mostly safely, with great safety profiles, great efficacy profiles. And there's a lot of new medications out there. I'm sure you've seen those commercials on TV. Those of you who have atopic dermatitis or psoriasis may have heard about them from your doctor directly. If you've hit a wall in the treatment, maybe your doctor has raised whipping up those medications to treat your ongoing condition. So therapeutic advancements are really a miracle. We can look back at the advent of steroids, for example, which go back to the 1950s. And they were a great advancement to treating chronic inflammatory conditions or even acute inflammatory conditions in people. And we've been using steroids for a very long time. We have a good track record with them. Steroids are largely safe and effective, especially if you use them judiciously and wisely, and avoid overdoing them, overusing them to the point where you run into side effects. So knowing how to use steroids or any other medication for that matter goes a long way. Knowing when to start using them, how far can you go, what the time frame to improvement is, and what are the side effects so you can back away from the medicine in case you run into side effects, knowing full and well that the side effects are due to the medication, so you can taper the medication or completely stop the treatment and maybe look for an alternative treatment in case the condition is still ongoing. So topical steroids, for instance, are a miracle in dermatology. We use them for a multitude of conditions, including atopic dermatitis and psoriasis. And again, knowing how to use them and really knowing the ins and outs of the effects that we expect of them, the time frame, and the side effects that you could potentially run into is very helpful. So you can use the medication with confidence, get the results that you want, and stop using the medicine before you run into side effects. Now let's take a look at a few options, a few of the new advancements that are offered in dermatology for the treatment of atopic dermatitis, for example. Calcineurin inhibitors, for instance, like tacrolimus or pimecrolimus, which are available topically in dermatology, have been around for a couple of decades. They're highly effective medications, very few side effects to speak of, very safe to use, and they can be used across the board in kids. We use them quite effectively as what we call steroid-sparing agents, meaning they give us the ability to maybe not rely on topical steroids or systemic steroids as much as we used to, and that gives us some leeway in using a couple of medications to complement each other and bring about relief with less potential side effects for each medication. Then there's roflumilast, which is a phosphodiesterase 4 inhibitor. Phosphodiesterase 4 is an enzyme that's involved in production of pro-inflammatory cytokines, which are messengers that are involved in increasing or creating an inflammatory reaction. That has been approved for children 6 and older by the FDA recently to use topically. It has ruxolitinib, which is a JAK 1 and 2 inhibitor has been approved by the FDA to be used in children which are 12 and older. Then there's dupilumab, which is an injectable biologic that has been approved for children that are 6 months and older. And then there's other medications such as oral JAK inhibitors, which have been approved for children that are 12 and older. And the list just keeps expanding and expanding. It's a very exciting time to be treating conditions in dermatology because there's so many more solutions nowadays than there used to be. As dermatologists, we're very fortunate to have this large offering of medications to offer our patients and their families to deal with these very difficult to treat conditions across the board. So most of these newly developed medications are actually quite expensive. Their cost is prohibitive. Their prices as patented medications are obviously very high because they're protected by patents. There's other issues with medication pricing in the United States. And the bottom line is that they are very pricey if you would be paying for them out of pocket. The good news for a lot of patients is that many of those medications are covered by insurance companies, and the pharmaceutical companies have also been making an effort to introduce those medications into the market. Call it what you will, but they do actually make an effort to provide complementary medications to patients so they can at least try them and see if they work. If the medication works, then sometimes you can get the medication for the patient at a discount, maybe sometimes even at the expense of the pharmaceutical company. They're obviously not saints, they're not a charity, so they are doing this for their own reasons, and obviously they're trying to carve out the market and create a market for those new medications that they've obviously spent a lot of money and time and resources developing, jumping through the hurdles of the FDA, and obviously they need a market for those medications to continue to stay in business. And the great thing about it is that a lot of those medications may be medications that we can pick out and use in those cases where the patient has hit a brick wall. Nothing of the previous offerings that we've had works for them anymore. Steroids may not be a good fit for them. Calcineurin inhibitors may have side effects that they can't tolerate. So we have these new offerings of medications that may actually work and help alleviate the suffering of those patients and their families. And that's actually a great thing. When treating conditions like atopic dermatitis, it's very important, extremely important, to pay attention to the fundamentals of skin in atopic dermatitis and really understand the root cause of atopic dermatitis, which is largely a genetically determined condition where the skin barrier is compromised for a number of reasons. And those reasons include genetics of the patients, and a lot of the times that involves dysbiosis or a certain makeup of the microbiome that lends itself to enhancing and perpetuating the inflammatory conditions that characterize atopic dermatitis. So this is a very complex condition to treat and very complex condition to understand. That being said, skincare, and I think the basic fundamentals of good skincare are something that needs to be paid attention to. And it needs to be paid attention to for several reasons. One is a lot of the trouble that people with atopic dermatitis face, specifically kids, can actually be solved or at least bettered significantly by applying proper skincare to the skin, not doing anything extra that could get you in trouble, not making the skin more inflamed, not compromising the skin barrier any more than we have to, and then helping replenish or build out the skin barrier again and helping the skin recover in the best way possible. So one of the most important elements that is sometimes overlooked in treating atopic dermatitis is actually empowering the patient and their family on how to take great care of the skin, to treat the skin with confidence, and first of all, do no harm. Meaning staying away from practices and products that are commonplace that most people get away with using when having normal skin, but people with sensitive skin, like patients with atopic dermatitis, cannot get away with. But the emphasis is to understand that a lot of those practices and products actually are not beneficial to anybody, meaning people get away with using them with having normal skin, but are not getting any benefit for using these products. And specifically, I mean products that are abrasive to the skin. Most of the detergents out there, most of the cleansers, and certainly most of the physically abrasive devices such as loofahs, sponges, exfoliating devices, washcloths, and so on, or even scrubs. All of these things must be addressed with the patient and their family. And they need to understand that those things are not benefiting them in the first place. They can avoid them with confidence, not worrying about missing out on anything, and continue to use very basic skincare, washing usually with lukewarm water with very minimal use of soap, if at all. And obviously using lukewarm water to wash or even cool water to wash, in not abrading the skin any further with hot water that can abrade the skin by scalding it and changing the conditions of the skin. That in it by itself, avoiding the abrasive practices and products, will actually prevent a lot of the undoing of one's work, one's therapy that people run into. Meaning they may use a medication that is highly effective on the skin. They may actually apply the right approach to the skin, but through habits that have been built over years or sometimes decades, people rush to use skincare products that undermine the skin barrier and undermine the integrity of the skin, and that can actually undo some of the benefits that you're getting with the right treatment. So that may end up as a net zero for the patient and their family, meaning they're using the right medicine, but the right skincare approach is actually abrading the skin and inflaming it, undoing the benefit that you're getting with the medication. So that's very important to understand. As I frequently addressed in my videos, taking care of the skin barrier through constant moisturization as needed is a very important step. In fact, it might be one of the most crucial steps to follow when treating sensitive skin conditions like atopic dermatitis, specifically moisturizing the skin with an occlusive, with an effective occlusive, such as petroleum jelly or a shea butter balm, Butter Oasis for example, is an important step to follow because restoring the skin barrier, allowing the skin to restore its own skin barrier while covering it with the occlusive can actually make or break the bottom line of any treatment. So if the skin is raw, if the skin barrier is compromised and you're using a medication to control the inflammation, but the skin barrier itself is continuously open to irritants from the outside or even from inside the body, you may actually be undoing your own work by not complementing the work with the application of a great occlusive such as petroleum jelly. The use of medications, as I often stress to my patients, needs to be done with confidence. How do we get confident? We get confident by being competent in understanding the lay of the land and how to use the medication appropriately, meaning how many times a day do you apply it? Where do you apply it? What is the time frame to improvement? When can you expect things to get better? And then once things get better, when can you stop using the medicine? And how can you avoid side effects? What side effects to expect, by the way, because some medications have almost built-in side effects or very frequent side effects that could deter the patient from using them once they run into them. They may not need to mind them that much, but at least they need to know about those side effects before they apply the medication, run into those side effects, and get discouraged and stop using the medication. So using the medications with confidence, specifically, for example, using topical steroids, twice a day. The specific topical steroid must be decided on with your dermatologist, but once you start using it, you need to know exactly how many times to apply, how long can you apply without worrying about side effects, what to expect as far as the time frame to improvement, meaning when can you expect the itch to go away. Usually with topical steroids, it's a day or two, and sometimes it could take longer, but what can you expect for symptoms to improve? When can you expect the actual rash itself to improve, meaning the appearance of the plaques and the roughness of the skin to improve? All of those things must be covered with your board-certified dermatologist. Now, medication changes can sometimes be a little haphazard, meaning people can sometimes get frustrated very quickly and push to change medications. You need to know that some medications need to be given a little bit of time to work, so you need to be patient. Obviously, patience is a virtue, but I don't want you being too patient for nothing. I want you to be patient by understanding exactly what time frame you're looking at here and be reasonable about the time frame to make sure that the medication still has some time to go before you give up on it and change to a different medication. Jumping around between one medication to the next might be missing a great medication which would have been perfect for you had you not lost patience with the medication you were trying for lack of knowledge of when the medication should fully work and give you the full extent of benefit that it could have given you. So all these things need to be clarified, and you need to have all that information in front of you when you start using a new medication, and obviously continue using a medication long term, as atopic dermatitis might be a chronic condition that could be around for months or sometimes even years or decades. And finally, I always tell my patients, I want you to use the medication. I want you to use it with confidence, but make it a last resort. And last resort, by the way, does not mean that you hold your breath and suffer through everything, but there are symptoms and there are signs that you can actually take care of by doing basic skincare that will, first of all, not make the skin worse, meaning not undermine the skin barrier, as we discussed, avoiding the abrasives. And in moisturization, in and of itself, could actually make a huge difference and save you a lot of medication use down the road. So hold off on the medication until you really have to use it. You may not need to use it, and you're going to save yourself medication. You're going to spare yourself the side effects, which are par for the course if you use medications indiscriminately. So last resort does not mean that you're holding your breath suffering through anything. Certainly not. But it means that you have some other tools in your tool belt that you can whip out and use before you jump ahead and use the medication. Ultimately, I want the patients to be their own boss. I want the patient to know exactly what to do day in and day out with their skin, how to maintain the skin barrier properly, and then have the medication ready at hand to use without asking permission, by knowing exactly when to use the medication, how long, and when to stop using it, when to go back to it, and so on and so forth. So atopic dermatitis has a lot of great treatment options. Obviously, more are coming down the pipeline, which is terrific. We have a lot of offerings to give. That being said, taking care of the fundamentals, taking great care of your skin, maintaining the skin barrier should be front and center, and that should be your focus when treating chronic conditions such as atopic dermatitis. For more information on how to take care of the skin in the most cost-effective way possible, pick up my book, 6Skin. Skincare Made Simple on Amazon.com, now available in audio. If you've enjoyed this video, don't forget to smash that subscribe button. Also, don't forget to share and like this video. Thanks for watching. God bless.